Hi, I'm Dr. Rachel Tate from ACR 2023 in San Diego, coming to you for RheumNow.com, and I have the privilege of interviewing my friend, who's been my friend for a long time, Dr. Hillary Norton. She is a very accomplished rheumatologist, researcher, and patient who practices in Santa Fe, New Mexico. And thank you, Hillary, for agreeing to do this interview with me.
Thank you for having me.
I appreciate it. Tell me a little bit, and share with our viewers, if you don't mind, tell me about your personal experience with ankylosing spondylitis.
Sure. Well, it's no secret that I was eventually diagnosed with AS as an intern. First month of intern year in the ICU, so no stress there, right?
No stress.
But, that was following 10 years of issues with back pain and uveitis and misdiagnoses, and so, I get that delay and what it really feels like, what that journey really feels like. And then, like many patients, I was hesitant to start treatment for a variety of reasons. I really get what patients are thinking on so many levels, faced with, going to a big medication. So I know a little bit about the natural history of this disease and what happens when you're not treated, but I think that really helps me to understand what that patient is going through when we're having these discussions.
So did your experience play a part into why you chose rheumatology?
Oh, absolutely. I mean,
you're fabulous because of this experience alone, but what you provide to patients. So tell me a little bit about that.
Well, it was on my radar, but then I just spent all of my time reading about rheumatology. So, my whole intern year, that's basically what I was doing when I wasn't studying other things. So it just made sense, right?
It was a natural fit.
Right.
Were you interested in clinical research and like the nature of your job search with your employment, your career?
Yeah, it's funny, private practice and clinical research was not on my radar when I finished fellowship at all, and through a series of interesting events, I hit the ground running. I started my own private practice right out of fellowship, and it's evolved over the years. So it's evolved. We now have a robust clinical trial program, which is so exciting for our patients, really. So
I love it. But outside of clinical research and private practice, you do a lot for advocacy. So tell me a little bit about that.
Yeah, I see a lot of patients who come to me, as we all do probably, for second opinions, who have had experiences that they're less than happy with. And I get that. I mean, we're burned out. Our jobs are hard, right? Yeah. We work really hard. So I understand that sometimes they want a little bit different fit. But the stories I hear really consistently when I meet new patients are, thank you for listening. Nobody's ever listened to me before. And I think it's been very humbling as the years have gone on in my own practice. I've realized that, we have our agenda. We want to treat to target. We want to get certain outcomes for the patient. We want to do the very best for them. But these diseases present in such a heterogeneous way, and sometimes simply listening and validating what people are going through and then providing them with information to make informed decisions as opposed to trying to make decisions for them really goes a long way. So I think I've sort of settled a little bit, and I will give them time to think and, to just really participate in their health.
So you develop relationships with your patients? No, I joke.
We all do, right?
I know.
That's what we
hope
do
to
in rheumatology,
yeah.
Right? I think we're all really good at that, but it's a process. I'm constantly learning and hopefully getting better, but it's a process.
Well, you provide the color to the context, right, to everything that they're experiencing, and because of a shared experience, even though it may be different, it does provide almost like a common ground to be able to start a conversation.
Yes.
And the understanding and the maybe the empathy and the sensitivity that it takes to practice rheumatology in 2023 and beyond.
Yeah.
So what's next? What's on the radar for Dr. Norton?
Well, we're growing the clinical trial program, so that's very exciting. We moved to a new building, but our practice is really focusing a lot more on wellness right now. So we're bringing in some new wellness options. That's what patients want. We're going to start some interesting things around walking and nutrition. These are things that patients have been asking for. So
that's awesome. Well, I'll come walk with this doc any day. So thank you.
I would love that.
I would too. Thank you so much, Hillary. You are just a delight. And honestly, for this and other updates around ACR 2023, check out rheumnow.com. And of course, follow Dr. Hillary Norton and myself on Twitter.